and welcome to the What's Your Story podcast. I'm Missy Day, and with me today is my partner,
Michelle Housebeck. Hello out there.
And a very good friend of ours, Dr. Mary Ann Martin, a.k.a. the Hormone Hacker.
I'm so happy to be here.
It's good to have you here.
Thank you.
So let's start out by just sharing with the audience who you are and what does Dr. Hormone Hacker mean?
Well, I have been an endocrinologist for over 18 years. And in the beginning of my career, I did what I was told. And I just did what I learned in medical school, which was here's the disease, here's the medication. And if you have a side effect to that first medication, here's another medication. And the turning point came when I found out there was a huge family history of type 2 diabetes in my family, from my grandmother all the way to my own mother, which prompted me to get tested. And I too was at risk for diabetes. And it was at that point I had to look at myself in the mirror and say, all these medications that I'm prescribing to patients, do I want to take these medications? It was a huge no, but now I had to do the research to find out how I could reverse this with just lifestyle and holistically. So that's how Dr. Hormone Hacker was born.
That's awesome.
Yeah.
And so in addition to your practice, was still called a practice, right? Because now you're a coach.
It is. So I do both. I still help people balance their hormones. I love working with women, especially because I feel oftentimes we're not heard as well as we should be at doctors' offices, and we're not given the time. And many women tell me that even when they come with whatever concerns they have, it's brushed off. Many women come with menopausal symptoms, for example, and they're given an antidepressant. So I love being able to help people look deeper into what's going on, ordering the correct comprehensive labs so that we get a clear picture of what's going on. And then I'm not vilifying medications, but I do like to explore the options when it's available. Can we actually take control of our own health naturally and then use the medications as a second resort instead of doing the opposite?
Right.
Since you've changed ways that you approach this, what would you say, even if it's a guesstimate on like percentages, there are X amount of patients that were on medications or would have been previously prescribed medications, but now are able to tackle whatever the issue is with lifestyle changes?
Well, I can absolutely give you the statistics for diabetes. 80%
Wow.
is able to be controlled, reversed, prevented without medication.
Reversed.
Absolutely.
Okay.
The thing is that I used to get people at the end stage. I got the train wrecks. Because when somebody had very difficult to control diabetes, saw their primary doctor, and the primary couldn't take care of the issue, then I saw them. So I was seeing people with very, very high sugars. That's not my sweet spot. I love being able to help people at the earlier phase. Why would you wait until you've already had the severe stage of the disease? Why not tackle it in the very beginning when it's much easier to reverse? So that is who I love to work with. Somebody who, let's say, knows that they have a family history of diabetes. They might be concerned that they could be at risk. This is the perfect person to actually be proactive and get tested. That's another story, is that most of the time when you are going to be tested for diabetes, it's just a fasting glucose. Maybe they will also do a hemoglobin A1C, but those two tests don't come close to a fasting insulin, which can tell us your risk 7 to 10 years earlier than just a glucose and an A1C. But do you know less than 1% of people are ordered a fasting insulin?
Wow.
So a lot of this is getting missed, and it could be caught so much earlier.
Right.
So going back to what you said about reverse, so I remember when Fred my husband was diagnosed with type 2 diabetes. And I asked the doctor, I said, so is this like something that could be corrected? And oh no, he will have this for the rest of his life.
So I'm going to give an answer that's going to let both people be correct. I'm going to be Switzerland for a second. So what the physician said partly is correct, because we know that when someone has diabetes, it has already been working in their arteries and their organs for several years before it's been detected. And again, we just talked about why, because people aren't getting the right tests. So when Fred was diagnosed, he was already 7 to 10 years in to the process, affecting his body. So does diabetes does it exist in his body? Yes. But does he absolutely need medication for the rest of his life? That's 100% debatable.
Right, because then there was another question, that Fred asked, because so I'm not going to be able to eat sugar again. So I'm thinking there probably would have been a correct response, to change. Well, actually you can, because you're taking medication now, so you can eat whatever you want.
So that would be the polar opposite of what I would say. Woo. Yeah. So that is part of my mission, is to let people know that, number one, when they have a diagnosis of diabetes, number one, their world is not over. Their world is just beginning of how they can manage it, because it absolutely can include a wonderful quality of life. You don't have to start saying, oh my gosh, I'm so deprived, I can never have this or that, or you go the other way and you just take more medication to eat what you continually had that caused the diabetes in the first place.
Right.
So I want to take some time to talk with you about your thoughts on the hot topic, the GLP-1s.
Yes. So I have a lot of experience with this as an endocrinologist. Many people don't know that these medications have been around since 2005. And the celebrities just discovered it a couple of years ago. And so what happened was, back then, when it was only prescribed for type 2 diabetics, the only people who were prescribing it were either endocrinologists or primary care physicians who had a very extensive knowledge in the realm of diabetes. We didn't have everybody prescribing these medications, which I thought was a really good safety measure, because I'm of the mind that no matter what medication it is, I use the smallest dose for the shortest amount of time when it comes to medications like this. These days, if you get a prescription for this medication, there's a protocol, especially at compounding pharmacies or med spas, because they don't have an intimate knowledge of how these drugs work. So they're already going to follow this schedule to get you ramped up to the highest dose as quickly as they can.
Wow.
And that's why we're seeing so many side effects. We're seeing such rapid weight loss where the person taking it is so excited. But let me tell you what's going on the inside. I used to say that before somebody gets a prescription for a GLP-1, they should have a body composition. They should know their baseline fat, skeletal muscle. They should know what's going on the inside. Because, let me give you an example. There was a 68-week trial with semaglutide, which is Wegovy. Wegovy was the first of this type of medication approved for weight loss and not just for diabetes. So people were on this medication for a year and 4 months. And they lost an average of 23 pounds. Now, that, for me, if I'm going to give myself an injection once a week, I better get more than 23 pounds. That's just me. But that was the average weight loss. Here's the scary thing. The 23 pounds was fat loss. 15 pounds was muscle loss. Now, many people who are on these medications are not also being educated on what they're supposed to eat. They're just told, this is the dose you take the first week, then you increase it on week 2, etc. But they're not told the proper amount of protein, what exercises to do to prevent muscle loss. And then when there's nausea, they're not doing the proper things in terms of adjusting the dose. So it's very problematic. Now, if someone goes on this medication and they're used to eating out, quite a bit, and maybe there's some fast food, so they don't have great habits. And now with this medication, they're eating 40% less, but they're just eating 40% less of bad foods.
Right.
If they're not taught healthier habits, when they go off this medication, that noise, that hunger is absolutely going to come back. When they regain the weight, they're regaining only fat. They're not regaining muscle. And muscle is incredibly difficult to regain as we get older, especially after 50.
Because these medications weren't intended for anybody, right, to be on long term.
Correct.
Okay.
Yes. I mean, they are supposed to. Here, I'm going to be very fair about this. Even when I was prescribing it for type 2 diabetics, there were some people, this was a miracle in their lives. It was the first time that they saw results. They were motivated to actually do better because they felt better. So there is a population where this is a game changer.
Right.
But I would say many people who are on this, that's not the case. They want a quick fix.
Yeah.
They don't want to do the work. And now that the FDA has just announced that some of these medications will not be available anymore at compounding pharmacies. So what does that mean? It's going to cost more for the actual prescription. There could be shortages for the people who need it most,
Right.
which are the diabetics. And there can be discontinuous treatment where they're on it, but then a month goes by, they can't get it, and then they have to resume again. And so it's going to be incredibly problematic.
Jeez.
So how are they able, because it seems like now it's everywhere, and I mean off-label. What
Yeah.
does that even mean, off-label?
So this is the scary thing, Missy. When something is off-label, the FDA has not approved it to be used for that, which means there may not be enough clinical studies for the FDA to feel comfortable to say this is okay to be used for weight loss. To be fair, there are several studies that have been published, and many people are not having long-term side effects.
Okay.
But 5 to 10% have very serious side effects above and beyond just what we would commonly see, which the most common side effects would be nausea, vomiting. That sounds fun.
Right.
Headache, fatigue, and then for some people, they are very sensitive at the place where they're injecting, and they can have irritation, skin breakdown, infections. That's rare. But the more severe things that can happen, you can affect your gallbladder, your pancreas, you can affect the kidneys. The biggest concern is that for somebody who has thyroid disease, who possibly has a family history of thyroid cancer, there's a 58% increased risk for thyroid cancer.
Whoa.
Yes. So this is a conversation that needs a lot of attention before somebody makes the decision to go on it. And I think the other myth is that, well, it works so well for my best friend, I think I'm just going to go on it too. It can have two completely different reactions in people.
Right.
And so this is why I truly feel only specialists who are incredibly knowledgeable on what this drug does and be able to take the time to counsel patients on what they really can expect, short-term, long-term, and have a sustainable plan to come off of it. Without that, I think we're prescribing it incredibly irresponsibly.
How do you even get to the point where anybody can prescribe anything? I mean, is that just like a blanket, I don't want to say perk, but
Like
if you're-
spas or something, you mean?
yeah, like how can they do that?
So this is where you have to initially fight with the insurance company and give them a reason for why
Okay.
this person needs to have this medication, even though it's not indicated for that reason. To be fair, there are a lot of off-label reasons that you can argue to the insurance company. We know when you're at a healthier weight, your risk for heart disease, blood pressure, cholesterol, all of that goes down. So that's usually what's happening. People who are on these medications for weight loss reasons probably have another reason.
Got it.
Anytime the BMI is over 30 and you're categorized as obese, that increases your risk for all kinds of metabolic diseases. So that's already a reason in and of itself.
Right.
So that's how you can prescribe things off-label.
Okay. Wow.
Yeah, wow.
That's scary.
And it's about to be a $100 billion industry by 2030. So right now, 1 in 8 people in America have either been on the drug, short-term or long-term.
Yeah.
That's a lot of people.
That
Do
is
you think a lot of it's celebrity driven?
I hate to throw the Kardashian card at this, but I will, because we're in this age where we are following a lot of celebrities on social media, and they are looking perfect, and in a very short amount of time, without having surgery. And so it's very appealing.
Well, there's always seemed to be a trend throughout the years of, especially with weight loss, like the pills or products or whatever it is, or an ingredient that, allows you to eat crap, and it's, hey, it's not as bad for you. Unfortunately, I feel like this is the trend right now.
And one thing that I'm not seeing on social media that I absolutely would love for people to shout from the rooftops: women who are in childbearing age, if they're on this medication, they need to be on birth control. You cannot be on this medication if you get pregnant. And that's another miss when just a compounding pharmacy or a med spa is they don't even know
Wow.
that to say to the woman.
Yeah.
Wowie. Well, to switch gears, kind of. So you are in the What's Your Story Speaker Bureau now, and we're so thrilled to have you. So can you share like the topics that that you speak about and how people can get a hold of you if they'd like you to come and speak?
Absolutely. So I love talking about GLP-1s, just like we're having this conversation to educate people better. I am very passionate about how to reverse and control diabetes holistically, since it's a part of my personal journey. I have now also had a personal journey of being able to stop juggling and integrating work, life, family, faith, and really be able to have more harmony, because there's no such thing as balance. It has to be harmonized.
Right.
And so, yeah, these are the topics that I'm incredibly passionate about. People can message me at drhormonehacker.com. That's my website. But, of course, they're going to be reaching out to you, Missy. And so, yes, anyone who needs, someone to speak at a women's conference or a health conference, this is where I have so much passion to be able to educate.
Well, I can't wait to put this show up on social with
Yes.
the tag of GLP-1, because I just had somebody reach out yesterday and she said, I'm thinking about going on, blank. And what do you think? I said, just wait until tomorrow. I'm going to send you a link to our podcast, and a doctor's going to be talking about it, and you can decide from there.
And I just want to say one thing. I have met with Dr. Marianne for my own personal health reasons, and she's virtual. So you can meet with her. She's extremely flexible with her time, and because I know she travels a bit too. So that, to me, is a huge convenience factor, whether you're meeting with her for the coaching program or running the labs or whatever it is that you're doing. I love that you are flexible like that.
It works for both sides.
It does.
Well, thank you, Dr. Marianne, for being on the podcast today. And I think you're just a wealth of information and so fun.
Yes.
And I can't wait to see you out speaking and doing your thing.
Me too. Thank you so much.
Thank you.
Thank you, everybody.